Hello, I'm Dr. Deepthi Memori, consultant neurophysician, Visakhapatnam. Today, I would like to talk about epilepsy, the important aspect being consistency and recording in medication regarding patients with epilepsy. So, epilepsy is a disorder in which there is increased firing of neurons in the brain, and there are different types of epilepsies, like generalized epilepsies and focal epilepsies. So, the recording of the patient means regarding the history of patient is very important in diagnosing epilepsy because the medications change for different types of epilepsies for focal epilepsies and generalized epilepsies. In the sense, so the history regarding the epilepsy, the patient should be able to describe event in a manner how it started, like the premonitory symptoms which the patient felt, and after that, how the patient had a seizure. For example, if it's a generalized seizure, there is tonic-clonic movements of both upper limbs and lower limbs. And if it's a focal seizure, there will be only tonic-clonic movements of one upper lip and one lower limb, or any sensory phenomenon in one upper limb and lower limb like that. If it's an absent seizure, there will not be any convergence. Only the patient will be staring and the patient can't speak during the episode, or if there are any myoclonic jerks. So the recording of the event and the consistency in telling is very important from the patient aspect of side because the treatment is different for different types of seizures. So regarding the medication, there are different types of medication for generalized seizures and partial onset seizures. And partial onset seizures with secondary generalization and absence epilepsy and myoclonic epilepsy. So regarding that, the history and the video recording of the event from the patient is also very important in prescribing medications for the patient. So after analyzing the seizure semiology and looking at the imaging and EEG findings of the patient, we should start the appropriate medication. Starting an appropriate medication in an appropriate dose is very important for the patient, along with the patient complaints. So for generalized seizure, there are some types of medication. For focal seizure, there are some types of medication which can be started. So 7 out of 10 patients with epilepsy, they respond to one medication after starting the seizure medication. 3 out of 10 patients will not respond to single drug. So second add-on therapy is recommended in that patients. So like if the patient is having seizures despite using 2 medications in appropriate and maximum tolerable doses, it is described as drug-resistant epilepsies. For drug-resistant epilepsies, if there are any causes like mesial temporal lobe sclerosis or focal cortical dysplasias or any tumors, then we'll go for epilepsy surgery. Before going to epilepsy surgery, the patient will undergo a battery of investigations, including MRI brain epilepsy protocol, scalp EEG recording, video EEG recording for 24 hours, and recording of the seizure semiology along with the video EEG, and PET scan, SPECT scan. After going through a battery of investigation, the patient can have resective procedures or disconnecting surgeries regarding the epilepsy surgery, and the proper decision should be taken by an epileptologist after titrating the maximum tolerable dose of medications. Thank you.